This is One-on-One. We're pleased to welcome Dr. Stephen Angeli, who is a cardiologist at Holy Name Medical Center. The topic I'm going to talk to you about today, one of the topics, is angioplasty. What is it?
Angioplasty is a medical term for the opening of a blocked artery, pure and simple. And angioplasty has evolved over the past 2 decades from simple balloon angioplasty, where a simple balloon would be placed inside of a blocked artery. We're talking about the heart now, blockages that would occur in the heart. Open that balloon and remove the balloon, and you'd be left with a wider passage for the blood to flow.
Who's a candidate for that?
And the people that would be candidates for that, first and foremost, would be somebody that's having a heart attack. So the procedure is divided into what we call emergency procedures and more elective procedures. An emergency procedure would be somebody that's coming into the hospital today, now, having chest pain, having a blockage. They need to be brought immediately to an X-ray suite that we call the cardiac cath lab, where we take pictures of the arteries with a test called an angiogram, and then when we see a blockage that we can fix, we fix it. And mostly today, patients will receive 1 or 2 stents to unblock their artery.
It's interesting. The whole question of these angioplasties, okay? I think there's a lot of confusion about it. I think people don't know exactly what it is. Is it as invasive as, is it invasive?
It is an invasive test, but it's not surgery.
Explain that part.
We don't cut any, there's no incision. The procedure is usually done through a puncture, either through the femoral artery, which is in the groin area, or mostly today we're going through the wrist. And the wrist provides access to the arteries of the heart with a quicker recovery time and a safer procedure overall. So at Holy Name, 90% of our angioplasties and cardiac catheterization procedures are done through the wrist, which is already a standard elsewhere in the world. In Asia and Europe, that's what they're doing. And only now is the United States starting to catch on. And Holy Name is, I would say, way ahead of the curve in terms of doing that.
Talk about this. There's something called, because trials are important. And I'm not sure if this is a clinical trial, but you're the principal investigator, the leader, it really means, of a trial that works to introduce angioplasty to hospitals that don't have it right now. It's called the Seaport trial. What does Seaport stand for?
Seaport was a trial that originated through Johns Hopkins Medical Center and brought to hospitals such as ours that are community hospitals that have a cardiac cath lab,
right,
and can do cardiac cath, but didn't have angioplasty. And over the past 15 years or so, we've been doing angioplasty under the auspices of Seaport, allowing our hospital to do these procedures, reporting the results back to Johns Hopkins, and we've collected a huge amount of data. And what that shows us is that it is safe to do these procedures in a community hospital if care is maintained to provide well-trained staff, well-trained physicians, and adequate volume of cases. When we make sure all those safeguards are in place, we deliver angioplasty services as high quality as a hospital which has open heart surgery backup.
Was that the whole idea of it, is to find out where and under what circumstances you could use angioplasty procedures and where they were, and what conditions you would have to create to make sure they were safe?
Well, you know, understand early on in angioplasty, it was not as safe as it is today.
How long ago? How long ago was the medical literature questioning it?
The first angioplasties were being done in the 1980s.
Okay.
So we're talking 25 to 30 years ago. Yes, they weren't as safe as they are today.
Dramatic improvements?
Dramatic.
Based on what? Like what kinds of changes are we talking about?
The things that have changed are the equipment. Industry is helping us between pioneers in this field who are researching different stents, different quality of apparatus to deliver stents safely, new medications that provide better support for these procedures. And so over the past 25 years, the procedure has become safe enough to say that in certain places it's even being done as an outpatient procedure.
As an outpatient?
Patients can go home same day. Now, we haven't gotten to that point. Usually patients will stay one night, but it is a safe enough procedure where the chance of needing open heart surgery then and there is extremely remote.
Doctor, I'm going to ask you this because this is one thing I do know about you that is atypical for a lot of physicians. You are fluent in 4 languages: Italian, Spanish, Korean, and English.
Well, my wife says my English isn't so great.
Well, what's the deal with the 3 other languages?
Well, just Italian I learned when I went to medical school for a few years in Italy. And then after that, I started to see fewer Italian patients, but more Spanish-speaking patients, and I thought I could learn that language, so I helped.
Spanish you picked up? So what's the Korean
and the
issue?
Korean, again, I live and work in Bergen County, and we're experiencing an explosion of the Korean population.
Which is part of the Korean outreach program.
Right, we have a Korean outreach program.
Excuse me, the Asian outreach program.
Now it's called the
right.
Asian outreach program at Holy Name. So it dovetailed into that. I'm very happy that I can start to communicate with patients, understand their symptoms a little better directly from them rather than going through a translator. And also, when you learn the language,
seconds, go ahead.
When you learn the language, you also learn a bit about the culture. So I think when you learn some of the culture, you can understand what are the barriers to getting good care. Why don't patients listen to you? And if you understand their culture, you can get through.
Well said, Doctor.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey Resources, Steve and Elaine Pozycki, the New Jersey Education Association, the Northward Center, Investors Bank, New Jersey Sharing Network, and by Choose New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.